Good afternoon, everyone, and welcome to today's webinar, Disrupting the Color-Coded Labor Market, Implications for Public Health. I am your host, Sume Ndumbe-Eyoh, and it's a real pleasure to have you on here today. Please take a minute to introduce yourself in the chat box. I see a few people already doing so. Would love to hear a little bit about what you're working on in terms of health equity work and also your organization. I'm on the line today with my colleague, Jamie Steve, and you'll see Jamie in the chat box. And if you have any questions or need some help doing today's webinar, you can just let us know, and she'll be happy to help out. I'd like to acknowledge that today's webinar is being hosted by the National Collaborative Center for Determinants of Health. We are located in Mi'kmaq, which is the ancestral and unceded territory of the Mi'kmaq people. And I think in today's webinar, we'll be talking about what public health organizations and really organizations broadly can do to improve equitable outcomes. So I think that's a really important thing for us to consider as we think about distinct experiences of Indigenous people. So while our webinar today is not what it's focused on, but I just want to leave us with that thought in our minds so we can think about how we expand our work to include that. And throughout today's webinar, if there are questions, I'll be happy to share some resources, some really great colleagues doing work around increasing Indigenous cultural safety. The National Collaborative Center for Determinants of Health, our focus of the center is really supporting public health researchers, practitioners, and organizations to address the social determinants of health in everyday public health practice. So it's a pleasure to have you all on the line with us today. We are one of 6 national collaborative centers, and you can see the centers on your screen. So depending on the kind of work you're doing, I really encourage you to check out work from our sister NCCs. We have an NCC which focuses on Indigenous health, one on infectious diseases, healthy public policy, environmental health, and methods and tools. And you can access the NCCs either through their individual websites or by going directly to NCCDH.ca. It's a pleasure to be co-presenting today with Dr. Fareen Karachiwalla, who's the Associate Medical Officer of Health with York Region Public Health. And today, Fareen will be sharing work which she did while she was with another health unit, but I think I'm really grateful for the leadership she's showing in this work and really helping public health organizations think about how we bring questions of equity and racism home, like how we actually look at that in the context of our own practice. Hi, Fareen. And Fareen is joined with her team. Do you just want to say hi to the group before we go on?
Yes, hi everyone. Thanks so much for having giving us the opportunity to co-present. And I just wanted to briefly mention I'm also here with 3 of our colleagues from York Region, our health equity nurses, Rachel, Kim, and Tina, and they'll be helping us participate in the case study that we have later on.
Great. Welcome. Great to have you on. So just a little bit about our intentions for our time together today. So today we're really hoping to provide some insight on the relationship between racism, employment, and income in the Canadian context. And we'll be pulling really from national level data which explores this relationship. I think we all know that racism, employment, and income are determinants of health, and they all interact with each other. So I will be sharing some information there just to give you a sense of what this looks like in the Canadian context. And then we'll follow that by really talking about what public health organizations can do in the context of their everyday work.